This is the AAOS Career Podcast, part of the Bone Beat Orthopedic Podcast channel. This monthly series features conversations on professional development and growth opportunities within the field of musculoskeletal healthcare.
Hello everyone, I'm Rex Lutz, Chair of the Resident Assembly Executive Committee, and this is the AAOS Career Podcast. In the last episode, we talked about how to develop leadership skills and take on increasing responsibility and accountability throughout the course of residency and fellowship. This episode jumps ahead to when we become attendings and are the leaders of clinical and surgical teams. Joining me to talk about that transition and to offer advice on how to create a strong culture, both surgically and clinically, is Dr. Greg Gilson, an adult reconstruction surgeon at St. Luke's University Health Network in Pennsylvania. Dr. Gilson, welcome to the show.
Thanks for having me. Appreciate it.
You know, when I was a medical student at the Philadelphia College of Osteopathic Medicine, you were chief resident there. One thing I always admired about your residency was the camaraderie and the culture that you guys had there. Were there any attendings that come to your mind when you look back that are the attendings that you wanted to model your practice after and to create that culture and camaraderie even in the workplace?
Yeah, I think I was lucky enough that through the Philadelphia College of Osteopathic Medicine, we had a large residency that we were all spread out a little bit around the country. And I had the opportunity and pleasure to, with some of my residency attendings, to go to fellowship with. And a lot of those guys down there, especially James Nace, who is also a PCOM grad, is who I've probably the most modeled my practice after, as I do a lot of the big revision aspect of joint replacements. And I think that's where I've modeled a lot of my practice after his, which was both a piece of residency and then also a piece of fellowship as well too, which is nice kind of through the entirety of it.
Yeah. And did you have trouble or just find any difficulties transitioning from being a resident and being a fellow to now being an attending? What challenges did you find along that way?
I think the biggest is the amount of responsibility. So it comes down to when you're a resident, you're a fellow, it is still all, you have someone that is overseeing you at all times. And then as you then get past that, you get to a point where this is all on you. So it's nice from a standpoint that you have people you can look back on to discuss, especially when you have complex cases coming up of, hey, what would you do to manage this and how from that standpoint? But at the end of the day, then it's you in charge of that operating room. And that's one of the biggest transitions is there's not someone to say, hey, what do you think? Does this look okay? It's you. It's people looking on you then to say, is this okay? So I think that's one of the biggest leaps. And there's not a good transition into that. During fellowship, there's a lot of that because you get more and more autonomy. But, you know, at the end of the day, when you then finish and you start your practice, it is you and it's you immediately. So I think that's the biggest and some of the scariest steps sometimes at the beginning.
Yeah. One of the things that kind of inspired this episode and made me have these questions is you go into now you're leading the OR, right? And there's a lot of people within the OR that are responsible for the outcome of the patient that you're meeting face to face. So one of the curiosities I had was, how did you, when you became an attending, transition to leading both your surgical team and your clinical team along the way?
Yeah, I think it comes back to a little piece of what I liked about my residency program as well. I worked with a lot of different docs through a lot of different hospital systems and a lot of PAs and a lot of surgical techs. And I got to see a lot of things done really well and some things not done as well. And you got to see how someone could work in an environment that is productive and that everyone within that environment is happy to be there. You got to see then the opposite of it. You got to see where, you know, it wasn't as good of a work environment. So I think some of the biggest was taking those little pieces of what you liked from how everyone else interacted with their staff and interacted with those who work with them all the time. So like I have a PA who works with me all the time. I have an athletic trainer who works with me all the time in the office and in the operating room. So it's nice. We have a team that sort of travels all around. We all are together all the time. So I think that's great and it's worked out very nicely. But I think the biggest part is treating people how you want to be treated, right? It's if you can harbor an environment where everyone likes to come to work and likes to work with you, that's how you get an efficient, good operating room and clinic staff that allows you to get through a very big day on both the clinic side and on the operating room side efficiently, and that everyone is happy to be there. So I think taking all of the, sounds cliche, but treating everyone like you want to be treated, from the person who mops the floors to, your co-surgeons who you work with. I think everyone should be treated exactly the same. And that's what fosters a good environment to work in.
Yeah, I 100% agree with that. I think that's great advice. Were there any mistakes you made maybe along the way early on that maybe, or maybe not necessarily mistakes, but things that you felt maybe didn't work as well as you may have hoped, or things that you've had to change as you went through this process?
I think the biggest thing is as you start practice, you come out and you're a lot of pieces of everyone else, and you have to start to adapt into your own practice. And it's definitely things early on. So when you start early on, it was me and my PA. We were doing cases together. We had no additional help. It was us. So we had to adapt from going from a fellowship where you have a PA, you have a PA with you, you have surgical techs, you have a whole team that's with you. And then when you start practice, it very much changes that at the very beginning, you have a very limited amount of help then, and you are then adapting to how do I take what I used to do with all these sets of hands and then make it work. So I think that was some of the biggest hurdles early on of just trying to figure out how do we make this work, because how we did it then, we had a lot of sets of hands. Now we don't have a lot of set of hands. So let's figure out how to do this, that it's still safe, efficient, and we can get patients taken care of and taken care of well without that same amount of help. And then over time, it's now evolved that I have more help, and we're in 2 rooms most of the time, and we're going back and forth. So we have more staff, more help. And that's another piece of what has changed. So you have to then start having much more, you rely on everyone else on your team even more so, because you can trust everyone. So that's how you can then become more efficient, because you have trust in everyone on your team. They trust you, you trust them. And that's been some of the biggest growth over time for myself, is that you can kind of relinquish the reins a lot of times and let other people help you. And that's how you can then keep things going.
Yeah. And you bring up a good point, not having as much help, and also developing your team with different steps and different processes, that it's new for everybody, right? So you have less help, and not everybody's maybe not on the same page right at the beginning, and it takes a little bit to build that. Whereas in fellowship, you have all those hands, but also you could do a whole surgery without having to say a single word. So that's a really good point there. The other thing is, when you're picking, I don't know how it works at your practice, but maybe picking the staff that works with you, how do you make sure that people are the right fit? And is there anything that you would, maybe if someone wasn't the right fit, how did you ever bring that up to your chair, the department, to say, hey, this might not be working out?
Yeah, a very good question. I am about the luckiest person to start practice, and my PA is awesome. I couldn't do this without her. When I started, she started at the practice at the same time. So we were randomly selected to be, randomly as much as the administrative set us up to be together wise, but we were kind of put together. I have had some athletic trainers who have worked with me. So one who, when I first started, she was with me in the office. Then she transitioned, her husband moved, she moved to another job. And then at that stage, then it started to become, I had a little bit more of a, hey, I like working with this person, I like working with this person, or we had a little bit more say of it wise. But when we first started, it was the two of us. We were put together. Neither of us knew each other. We showed up, and now it's been one of the best assets that I can have. Speaking to some of my colleagues, it has not been exactly the same for them. So it has been some growing pains for some other guys, from coming from residency and things. And it's just been discussions of, hey, this seems to not be, we're not working efficiently together. Is there ways that we could make changes that would benefit both sides? So it's definitely that conversation of, you say, well, hey, there's tons of people that don't mesh together. And you say, hey, we aren't on the same wavelengths. We aren't meshing together. Is there any opportunities that each of us could get into better places that we would be more efficient within the role and could work together with other? And that's where I think you try to work that avenue of trying to put the best people together that work well together. And that's how you then build big success.
Yeah, for sure. That's probably a very challenging conversation to have, but probably best for both parties and ultimately best for the patient. So definitely have to have those conversations. What's your dynamic like with the other members of the surgical team? Like there's so many different responsibilities in the surgery team, so many different personalities and skill levels, training levels, education levels. So talk me through kind of your experience with kind of having all those variables in your surgical OR, field or OR.
It's a lot. It's a lot to become accustomed to at first. So, speaking back to in fellowship time, you came into a well-oiled machine, and you were the next person into that kind of, and you fit in, and everybody was doing their thing. Then when you start practice, you are everybody looks to you and says, well, "What are we doing?" And it's a transition of, and I think the biggest one was it's just treating everyone respectfully, and if you are nice to them, they are absolutely willing to work with you and do things a little different. If you come in and you do things a little different than traditionally other people within the practice have, everybody will then build that. So I think the best way in those first early times when you're starting is you start off especially in the operating room wise, you start off on the slower side. You start off doing a couple of cases a day so everyone can get a feel for what you do and how you set things up. And that's so early on, myself and Kelly, my PA, we would be setting everything else up. This is what we do from a tourniquet standpoint, where we put the leg for knees and hips and things like that. And then over time, the staff, as they work with you, and as long as you harbor a good environment, they are then on par they know all of your steps, they know all of your setup. And then, so like when we're flipping from room to room and we're going and signing the next patient, talking to the last family, and you get in that kind of rotation that you get used to, they can set everything up and you trust that it is all set up. You come back and it's set up exactly like you want it to be. So that is some of the biggest. And I think teaching everyone that works with you and answering giving this is why I do it this way, I think is also big, because it allows them to understand why you maybe do something different, because you do it for this very reason. And I think explaining that rather than being like, this is how I do it. If you can explain that, it helps to then solidify that relationship of why you do things.
Yeah, I like that. Definitely, at least for me, I learn better when I understand why somebody is doing something, and I'll remember it forever in that case. And then, you bring up a good point. So you start to transition this autonomy, but at the same time, you're still responsible for that patient. So what's that like when you start to let people do more, transition further into their roles? You can't be everywhere at once as a surgeon, but you also are responsible for everything that happens during that patient's care. How do you handle that?
That was one of the hardest things, because we all, from a surgeon standpoint, are type A personalities, that we do something a certain way and that's how we want it done. And then relinquishing that was some of the hardest. And that just comes from you working with a team that you work together with all the time that you can trust. So like I would trust my team with doing anything. That has now allowed me, because one of the harder things now as you get further into practice, so early on it was all those, and then as you get a little further on, then it becomes, all right, I'm doing 8 joint replacements today, or 9, or whatever wise. And then it becomes like we're flipping rooms. You have to have the next room come back in time for efficient flow. And then but you need to be able to see the next patient, talk to the last family, talk to your previous ones from earlier in the day. And you have to try to compartmentalize how all that fits together, that you're not, patient is asleep or spinal, and you want to be efficient so that they're not, and it's this kind of balance of things. That's been some of the hardest. Then as you get a little bit further into practice and you start getting down, the staff knows what you're doing, or you think you know what you're doing at that stage of things. And then it's then the ancillary things of then trying to become more efficient and be able to get more done within the day safely. So you have to rely on your team. And so that's where building a good team with a good relationship is some of the most important aspects of practice.
Yeah, you initially have to teach them to work around like your steps, but then now you're almost learning how to work around their steps to efficiently fit everything and make your day just flow very smoothly. What if there's a mistake or a problem that somebody's making within your surgical team or clinical team? How are you addressing that with them without being too overbearing, or I guess you don't want to hurt anyone's feelings,
Yeah, I think the biggest thing is, so we as a team, then you build this relationship. So like you spend more time with the people you work with a lot of times than you do your own family. So they become your family. They are your extension of your family. And I think just having conversations, so being upfront and saying, hey, this happened, and there's no sense in you. So you as surgeon, captain of the ship. But I think if you're having any sort of issues, it's just being upfront, and we just have conversations with each other and say, hey, can we do this way or not do this because this happened, and we adapt and change. And it's just having upfront conversations with people about anything, whatever happens. Why? So typically it's small things. It's not typically anything large. And if you just say, hey, I prefer to do it this way because of this, and everyone responds well. And I think just being upfront with people is the biggest thing you can do.
So what I gather with everything that you said so far is you build that team, you build the trust, you treat them well, and then they're receptive to any kind of feedback that you bring about because they know you're coming from a place that's of good intentions as opposed to bad intentions.
Absolutely. At the end of the day, this comes down to, yes, this is a job, but it comes down to it's patient safety, patient care. So that's the biggest thing I think you have to always be taking home is why we're here in the first place. And that's to take care of patients well and safely. So I think when you build a team that has that trust, everybody has that in the forefront. So it's not when anything comes up, everyone takes it as, yep, and we adjust and pivot and move the team forward.
Yeah. Is there anything that you do with your team outside of work to build that camaraderie? I mean, it sounds like you guys are all pretty close.
Yeah, so we'll go out, after a long day of work wise, like we'll go out, we'll have a couple drinks, we'll get together, like families get together. We do a little bit of everything. So like my PA Kelly, she's got two kids. They're a little older than my kids. I have a 4.5 and a 1.5, and hers are a little bit older. But we get together on weekends, and her and her husband know my wife, and back and forth, and it's you become a family. It's similar to equate it back to like my residency family. Like back then, like all of our family got together. Like our wives got together more than we with them got together because they all essentially became a big family. So that is some of the biggest it's not just at least in my realm of things, to build a good team. It's not a turn it on for work or then turn it off right afterwards. We talk all the time outside of work and not about work related things. So it becomes a family and a friendship that you build forever wise, similar to, residency wise, or talk to all those guys all the time.
Yeah. And it just makes it so much more enjoyable. So how do you show appreciation for the people that you work with? Is there any particular ways that you do that?
So my biggest thing is that when we're in the office, try to every day that we're there wise, if somebody like we get lunch, I get lunch for everybody all the time wise, because I think it just fosters we're together, we're in this together. I appreciate them being there because it's the only way that I am able to get through my day efficiently and without going crazy in terms of having them all from a health standpoint of things. So I think it's just the little things that I can do that just help out from that standpoint of things. I think is just it's appreciate them more than they know from that standpoint of things. But I would hope that they know that this is a relationship that we continue, and I think that's why we've worked together so well through a standpoint of things. We all have mutual respect for each other, type of deal.
Yeah. If you could, if say I went up to Kelly or some of your other staff that you work with and asked them to describe the culture of your team that you've built, how do you think they would describe you and the team?
I think that it's a great environment to work, because in the end, when you look at it wise, it's a job, and you choose to work where you choose to work. Like it's everyone that is on my team has essentially chosen to work with me and with each other. You could, from a standpoint of things, work anywhere. So I think the fact that we've had a consistent team that everybody has maintained on that team, other than for life changing reasons wise, in terms of like leaving the team for heading out of state and that type of deal, I think that kind of points to the fact of we have a very good working relationship, and we have a great team that I would hope that they say that they are as happy to work with me as I am with them.
That's great. Dr. Gilson, thank you so much. This was an awesome episode, transitioning into practice in the next few years. I'm definitely going to take some of these key points with me and hopefully apply them to my surgical team and clinical team. So thank you so much.
Absolutely. Thank you for having me. I really appreciate it.
Thank you for listening to this episode of the AAOS Career Podcast, part of the Bone Beat Orthopedic Podcast channel. Production and editing provided by MK Quinn Media. Check out the video version of the podcast on the AAOS Career Podcast YouTube channel. To hear other conversations on professional development, please visit aaos.org/thebone beat.